Welcome back, everyone. And a big note of thanks to Jeremy and Elixir Kitchen for a really incredible cherry cocoa smoothie recipe. I hope to be able to get that recipe, and maybe we should try and publish it as part of in the chat for everyone as well. I'm really thrilled to welcome the next session. It's entitled Team Colorectal Cancer Canada, Education, Support, and Advocacy. Colorectal Cancer Canada, as many of you know, is the nation's nonprofit colorectal cancer patient organization. Very dedicated to colorectal cancer awareness and education, supporting patients and caregivers, always advocating on their behalf. The goal of the organization is to reduce the incidence and mortality of colorectal cancer in Canada and to improve the quality of life for patients, their families, and caregivers. To bring this vision mission alive for this wonderful organization, I'm really pleased to welcome two key members of Team Colorectal Cancer Canada. The first being Chana Cohen, a patient and caregiver support specialist who you met yesterday in the session I'm post-treatment panel, and Karry, who's the manager of patient education and research, helping patients to access the right information at the right time throughout their cancer care journey. I can say from personal experience, having worked with both Chana and Iris, that they're hugely dedicated to the work that they do, to supporting the patient community, and to making a very big difference to those going through the colorectal cancer journey. So today, the aim of this session is to share with you the types of resources, the types of information and support services that Colorectal Cancer Canada offers to patients, the community, and their caregivers. So Iris, without further ado, I'm going to ask you first, please, to introduce yourself a little bit, and of course, to talk about one of the newest programs, I think, in the organization called Tush Talks. And if you can introduce us to that initiative and what some of the activities look like over the next few months, that would be great.
Thanks so much, Anne-Marie. So one of my main roles that I have as part of my work at Colorectal Cancer Canada is to try to understand where the gaps in knowledge are in patients and caregivers and their families, and develop resources, whether it's a pamphlet or the short videos or a webinar, to try to address those unmet needs. And so Tush Talks is one of the ways that we decided to help address some of those unmet sort of informational needs in patients and caregivers and their families. And so the input for a lot of the topics that we've planned out for the next year come from input that have come from support groups, or from direct inquiries sent to our support email. And what we really want to do is to just explore these topics matters, and we have the sort of informal conversation to really bring important light to these areas that people want to learn more about as part of their colorectal cancer experience. And so for our next,
I was going to say, if you could give us a couple of topics that people can learn more about, what might those be?
So for our next Tush Talk, which will be taking place at the end of May, we're going to be exploring palliative care. So this Tush Talk is called Demystifying Palliative Care, and it will be taking place on Wednesday, May 25th, from 7 to 9 p.m. on Zoom. And our guest speaker will be Zelda Freitas, who is a social worker with decades of experience in the field, who will help discuss the origins of palliative care, how it's evolved over the years, and what palliative care can offer at different stages of a person's disease. So we'll be sharing that registration link to sign up for that. And for future months, we'll be exploring topics such as survivorship care. We'll be talking about fertility and cancer care, nutrition, and various other important topics that have been brought up to us by our colorectal cancer community.
Yeah, and just a note to the audience now, if there's topics that you think are of interest that you'd like to learn more about as part of Tush Talk in the webinar series, feel free to either put them into the question platform or into the chat. We'll be monitoring all of those as we go through. Chana, I know that you're responsible more for some of the support groups inside Colorectal Cancer Canada. Can you tell us more about that? And how people can access these groups, the kinds of groups that are available to those in the community?
Absolutely, Anne-Marie. So I'm very, very pleased to let everybody know that we do have several virtual support groups that take place on a monthly basis. These support groups are offered nationally, and truthfully, we even have people who from the United States have heard about them through various media outlets and have contacted us. So it's really nice. It's sort of one of the, I guess, one of the positives that came out of COVID, that we have this virtual community that we've started. So the format of these support groups are that we have typically a presentation either by myself or one of my teammates from CCC about a topic of interest, either that's come from the group or beyond. Could be more clinical, could be more psychosocial. And we do, first hour is a presentation, and the second hour is really just a bit of a Q&A or a discussion with the presenter about the topic. And then we do a roundtable of a check-in with all the members. These are open groups, so anybody can join at any time. All you need to do is send me directly your request at Chana C, C-H-A-N-A-C, at colorectalcancercanada.com. Presently, we have, and then I just do, a quick sort of intake call, discuss the patient. I like to meet all the patients before they enter the groups. So currently we have a 50 plus group, and we have a early age onset group. So early age onset would be anybody under the age of 50. And again, these are, we don't discriminate whether you're newly diagnosed, whether you're going through treatment, whether you're a year or 5 years out. We get everybody together, and actually the feedback has been great that people really, really enjoy discussing this with people at different stages because you get the different perspectives. In addition to this, we have a caregiver support group that was started several months ago. So most of those members are the caregivers or support network of the early age onset patients. We're also starting shortly, likely in June, an in-treatment group. This is coming out of our early age onset group where we have many, many in-treatment patients. Of course, the topics are, very different at that stage. So we want to be able to offer this to the patients and access those resources as well. So,
yeah, Chana, you said there's so many different groups. Actually, one of the most important things I think is the issue around separating young onset colorectal cancer. The issues are different. The issue is growing. Can you tell us about the impetus for that group, how it's different from an over 50 colorectal cancer support group? Tell us more about that, particularly knowing that this issue is on the rise.
Yeah, so sadly, it's the fastest growing cancer in the younger population. I'm not really too sure why. It's quite multifactorial, and so we're seeing, particularly when I was diagnosed, I couldn't find any support. I looked around the treatment room, and everybody was sort of like 70 years and older. So this is really an opportunity to get the younger community various programs around the country, even internationally, that exist for early age onset. And so we're connecting with those communities as well to really reach out and let people know that there is a colorectal specific group available for early age onset. So as you mentioned, Anne Marie, of course, life stages is the biggest differentiation between people in the over 50 population and people under 50. We're talking about fertility issues. We're talking about sometimes the dating scene. Not that you're not dating when you're older, but when you're dating in your 20s and you have an ostomy, it's a very different situation. We're talking about body image is a huge concern for many. We're talking about parenting issues. So there are many, many things that come up. Return to work, of course, all these things that are of interest and concern to patients under 50.
And if I don't want to join a group, but I just want information, particularly about early age onset, or I just want more information even about colorectal cancer in general, like how do I get that? And what kinds of resources exist for me?
So, of course, the group setting isn't for everybody. Some people like to do a more individual discussion, and so we offer that as well. We offer one-on-one support, counseling to patients, to caregivers, and the access through that is really just support, SUPPORT, at colorectalcancercanada.com. You can send an email. That's probably the easiest, and just those get forwarded to myself and my colleagues, and we will get in touch and set up individual sessions for patients who want to discuss things separately.
Yeah, that is amazing. I'm going to bridge back to you, Iris. One of the, what I call hottest topics in what I'll call it the global science world right now is the subject of biomarkers and genetic testing. There's so much information around this. The advances in science are huge. The advances in science in terms of their ability to help manage disease, particularly colorectal cancer, it's exploding. And very, very encouraging. I know that Colorectal Cancer Canada has a lot of different resources in this area. Can you talk about those?
Yeah, for sure. So for information specific to biomarkers and personalized medicine, we have our Get Personal program. And within that program, there are several different resources that are very accessible to patients and caregivers and their families. So the first is a biomarkers pamphlet, which is a really great overview of, what are biomarkers, when should testing be done, and how can biomarkers be used to help determine the best treatment for a particular patient. We have a hereditary colorectal cancer syndromes pamphlet, which goes into the different colorectal cancer syndromes, what kind of steps you can take to help lower your risk of developing colorectal cancer, and how biomarker testing can help with the selection of the most appropriate treatment options if a colorectal cancer diagnosis does occur. There is a really, really great sort of overview video of biomarkers, which is called Biomarkers, What Patients Need to Know. And that can be found on our YouTube channel, also through our Get Personal program page on our website. And then additionally, relating to the Get Personal program, we have the Immunotherapy Program, which we've just released sort of our finalized immunotherapy guide, which is ready, and it relates to just a guide intended to educate on the therapy, how biomarkers fit into that, and how to access immunotherapy in Canada. And that can be also found on our website under the Immunotherapy Program.
So all of the, what I call the science of this can be overwhelming. It can be complex for people. Somebody visits their oncologist, a lot of big science words are used, a lot of different options are put in front of people. How can colorectal cancer, what resources are available to the public in general just to, get help understanding some of the basics of therapy or the basics of care? It seems to be a bridge between the support groups as well as some of the informational materials. Like, how would I even begin to approach that if I was just newly diagnosed?
So I can address that. Exactly like you said, it's a huge gap between, the knowledge base of the doctors and the complexity of the disease and everything that comes with it. And sort of what people are able to digest and break down. We really need patients to understand what they're being told and what their options are so that they can really become strong advocates for themselves. They know what to ask. They know what lays ahead. For the most part, of course, there are surprises along the way, but we certainly try to break things down for people. So, for example, we have a few toolkits that are available to patients there, on topics that are very, very relevant to the broad scope. So, for example, a return to work toolkit that's that it's in its final stages of edit. So we're excited about that. The goal is to provide really insights into the concerns and challenges surrounding a return to work and, re-entering the market after a diagnosis and treatment. And it's interesting, it's divided, sort of by from a patient perspective and then from a caregiver's perspective and also from an employer's perspective. So you really get like a broad scope of what that's about. We also have a sexuality toolkit, talking about sexual changes and fertility in the context of colorectal cancer, treatment and survivorship. So again, we really want to arm people with tools to make things more accessible and more understandable, and reduce the fear that people have. There's another toolkit coming out as well, which is a LARS toolkit, lower anterior resection syndrome, written by one of our patients. So it's really dealing with the day-to-day issues that come up, the physical and emotional, and how to really sort of regain function and regain your daily activities. Again, we have webinars, a series of webinars that are available to patients that really break it down. We get into a space with professionals often and ask them the questions that we all want to know, that patients and caregivers really want to know. And these questions and discussions are driven by our patient community. So we know that we're addressing the right issues.
Yeah. Iris, did you have anything you wanted to add to that?
Yeah, and just adding to the toolkits, we have another really important toolkit, the Never Too Young Patient Toolkit, which was created to help address the lack of sort of tailored colorectal cancer resources designed with younger patients in mind. And so, as Chana mentioned when she was talking about the early age onset support group, this particular toolkit helps to address those very specific needs that young onset patients and caregivers face. So, questions on, sexual health and fertility, how to cope with side effects of treatment, strategies for navigating family roles and relationships, returning to work, etc. So this toolkit, again, tries to arm patients and caregivers with that information so they can be more prepared in their experience.
Yeah. I certainly know that a lot of the brilliance of your ideas comes from the community itself, whether it's through the support groups or some of the many other initiatives that Colorectal Cancer Canada runs. But if somebody in our audience today I've got a new idea, I need some help doing X, Y, or Z, how would they go about speaking with one of the two of you? Can they reach you directly? Do they go through the website? Is there an info line in the organization where people can talk to you?
So from my perspective, I mean, I'm very responsive on emails. They're checked. I work 4 days a week, so they're checked 4 days a week. The best way to do that is through support@colorectalcancercanada.com. That's probably the easiest way to do that, and have we can set up phone consults as well.
Good, good. I also know that Colorectal Cancer Canada is on social media. Do you want to talk about your social handles and the kind of things that we can see coming through social?
Sure. So
You want
we have our Instagram page. We have our Instagram page, which is at colon, and we have Twitter, we have our LinkedIn and Facebook, and so we promote our webinars and our events through our social media. Even the fact, if you've an event, we will post where to find them afterwards and make sure all of that information is accessible. Those resources are accessible to anyone who see them and sort of review them time at their own pace. So you can always sort of keep on our platforms to keep in touch with where we're going with our events and where to find all the information.
One thing I know, you guys are super busy, and I for anybody who hasn't signed up for any of their social media, please do. There's just an incredible amount of information on the website, which is colorectalcancercanada.com. So just one word, colorectalcancercanada.com. And of course, you'll find all of their social handles on that website as well. I wanted to bridge to, yes.
I'm so sorry. I just want to mention one other thing that, Iris works incredibly hard at is our monthly newsletter. So you can sign up for that by going to the website. There's a click button to sign up for the newsletter, and that will keep you very up to date on not just the events, but, Iris's research information, the latest research in the field, very important things that are included in that. So, and our programs, etc. So that's probably a really great way to stay current.
Yeah, thank you for calling that out.
Thanks, Chana.
And we've had so many amazing conversations as part of this patient conference. And Colorectal Cancer Canada has a strong mission of being a go-to resource in this space, which is why we really wanted to share with the community so many of the amazing programs, toolkits, information pieces that are available. I wanted to bridge to one final very large initiative that Colorectal Cancer Canada has done for the last 5 years that I've had the privilege of being involved with. This is their annual conference, and this annual conference welcomes patients, industry, healthcare professional, all stakeholders across the cancer care ecosystem in a way that pulls together in a very collaborative way a number of the very inventive and innovative ways in which cancer and the cancer care system is changing. So Iris, I think our audience would be very interested to understand the nature of these conferences, when they run, how they run, the kinds of things that we talk about at these conferences, and how patients can in fact attend. And we welcome the attendance of patients at these annual conferences.
So our annual conference takes place in November, and these conferences have been directed towards, how to change the clinical trial ecosystem and forming it into an environment that is more patient-centered. And so a great deal of progress has come from the past years, and especially this last conference in November of 2021. And we've seen it move into the development of another product that we have, the PACT, which is our patient-centered approach to clinical trials, which is all about, really bringing patients to the center of clinical trials, not just, as a partner, but as a creator, as, the actual voice in the entire process. And so this conference, again, happens every November, and we usually begin promoting it a month or two in advance, and everyone is welcome. And so just stay tuned on our social media to find out more information about how to participate.
Perfect. Thank you so much, Iris, for explaining that. And the reason I raise it is that it's not always common for patients to be engaged with industry, government, regulators in one conference. And this is what makes this conference so powerful. And while its core theme has been very much around patient engagement in clinical trials, as we spoke about in an earlier session, in this particular conference, it's very rewarding and very innovative to have what I call all stakeholders at the table, listening differently, hearing differently. And colorectal cancer has been very leadership oriented in this perspective. So again, as Iris said, watch the website, sign up, please, for social media with colorectal cancer, and reach out through what's the information line again, guys, so I don't get it incorrectly. Support at colorectal
Cancer Canada.
Yeah, that's always the trick. Support at colorectalcancercanada.com, and you can reach either Iris or Hannah, who would be very happy to help you. Any final comments, folks, on celebrating the amazing resources that the organization has?
Yeah, actually, sure. So if you don't mind, I just want to make sure that everybody knows sort of what we're looking at towards the next few months. We have some really exciting things happening. So number one, I want to mention my colleagues developed the CCC Champions program, which is peer-to-peer support. This is something very important that we're noticing patients, want to connect with one another through that. So we have some interesting ways that we're going to be doing that. We're going to pilot this project with a few of our patients now. And so we're really excited to get that going, get that underway. Another thing would be we have educational modules that are coming your way. So everything from, the sessions that are focused on newly diagnosed, all the questions that people have, all the topics that people need to be aware of without putting too much information into people's hands, because that can be dangerous as well. So, and then treatment modules, and then we're going to just continue. As I said, it's patient-informed education. So this will be coming in the next few months. Also, we have a Foods That Fight website that patients can visit, but we're going to be revamping this big time. So we're going to be empowering and educating people on healthy lifestyle choices to reduce the incidence and recurrence of cancer in the future. So it'll be pan-cancer, but some very, very exciting things that, we're going to make very accessible to patients, not scary. And we really want to connect with the community to give everybody what they really need to succeed.
Mm-hmm. I love the Foods That Fight Cancer. Did I get that correct?
Yes.
That's probably an amazing, fantastic.
Iris, is it www.foodsthatfightcancer.com? I'm terrible with remembering all these things.
The three of us will get it.
I think so.
It's foodsthatfightcancer.ca.
.ca, I apologize.
Perfect. But if we miss that, we can always go back to the support at colorectalcancercanada.com, right?
So send us an email and we will respond.
That's perfect. Good. Well, I'm all of you are as excited as I was to celebrate the amazing work that the organization does, very much led by Hannah and Iris. They do a fantastic job. And I can personally say from experience that they are extraordinary at listening and translating needs into prolific programs that help the community. So thank you both for joining us today.